Hello, I'm Dr. Karim Kurji, York Region's Medical Officer of Health. As our children return back to school on February the 16th, we have taken a number of additional measures to keep them safe. So we have masking for all those between grades 1 and 3, and for masking for grades 1 to 12 when they are outdoors and physical distancing cannot be maintained. In addition to that, there are new guidelines discouraging any congregations between students before school and after school. We have also, given the presence of the variants in York Region, modified our screening tool to make it more difficult for an individual to enter the school if they have any symptoms of COVID-19. So we have moved to a one-symptom screening tool, similar to the one that is used in Toronto and Peel, and have made other modifications. So should an individual have one symptom, whether they be staff or student, they are asked not to come into school and to access testing. With respect to testing, there are a number of additional strategies that have been deployed. So testing would be provided by a third-party vendor. In the event there was transmission within the school, as in a school outbreak, or if there were cases within the community and we had more than 5 cases within the school. In addition, testing by the third-party vendor would be available for cohorts that have been dismissed, as well as other individuals within the school. We are currently finalizing the arrangements for having additional pen bio testing, which is rapid testing, for students who may only have certain symptoms. And this testing would most likely be arranged through our regional offices, and the details are being finalized. As updates become available, we urge you to visit our website at york.ca/safe@school. As you have no doubt heard, we've had several variants in York Region, the number being about 60 at this point, with 19 of those being the UK variant. We know that they affect all age groups between 5 and 79, and they seem to be in most of our municipalities, and we do know that there's local transmission going on. We also know that they are much more easily transmissible. In fact, where there have been close household contacts, the close household contacts have become sick within a matter of 12 to 18 hours. Many of them becoming sick in just 12 hours. We are keeping a close eye on these variants. However, we urge everyone to ensure that they keep their physical distance of 2 meters or more and avoid anything more than the briefest of encounters with people outside their own homes. There is some good news in that our cases have continued to decline. Our institutional outbreaks seem to be going down, and there is early evidence that the vaccination efforts in the long-term care homes are paying dividends. The numbers of hospitalizations for York Region residents also seems to be declining. That being said, our hospitals are still under a lot of pressure, and the ICU units are also under a lot of pressure. So the situation is still precarious. When it comes to vaccines, we continue to deliver the vaccines to long-term care homes and retirement homes, and these are the second doses. As soon as supply chains get better, we propose to move to the other priority groups in accordance with the province's prioritizations. As mentioned previously, we have a vaccine task force made up of various sectors within the community, and they will guide us through the prioritizations at the local level. Details on our vaccination strategy are available on our website at york.ca/COVID-19 vaccine. Finally, I want to remind you that we are still under the stay-at-home order, and you are urged not to go out except for essential visits, and employers are urged to facilitate their employees staying at home and working from home wherever possible. Because of the variants in our community, we suggest that you follow all the public health guidelines, but in addition to that, ensure that you keep your 2-meter distance, and any encounters that you have with folks outside your household should be kept as brief as possible. Please stay vigilant and stay safe, and thank you.